Hey everyone, welcome to another episode of What's Up Wednesday. My name is Carly Burridge. I'm the owner and founder of Gaining Health. And every Wednesday we talk about something obesity related, a recent journal article, book, or whatever it may be. So today we're talking about a recent journal article in the Obesity Journal titled Sleep Fragmentation and the Risk of Obesity, the Sleep Heart Health Study. And the authors were Binbin Zhao et al. And this article was in the August edition, volume 29 of the Obesity Journal. And the objective of this study was to use polysomnography records, so home sleep studies that they use, to investigate the association between sleep fragmentation and obesity in close to 6,000 participants. And the results were no surprise here that the participants with obesity had significantly higher rates of sleep fragmentation compared to those subjects with normal weight. And so this is obviously not a surprise to anybody, but they go on to talk a little bit about sleep fragmentation. It's a common sleep condition that's usually caused by sleep disorders such as sleep apnea, narcolepsy, restless leg syndrome, or other external factors, such as either a poor sleep environment, substances like alcohol, caffeine, or sometimes even prescription medications. And there have been a lot of studies that have shown that this sleep fragmentation is associated with a whole range of physiological and neurological disorders. So this study really showed that there was a very clear correlation between sleep fragmentation and BMI. Now, this study, of course, only looked at correlation and not causation, but they did talk a little bit about the mechanisms behind why sleep fragmentation influences obesity, although they also state that this mechanism is not fully understood yet, but a lot of previous studies have shown that numerous neuropeptides and hormones likely play a big role in this. So the types of hormones and neuropeptides that we're talking about are things like orexin, which we know that affects wakefulness, activity levels, eating behaviors. We also know that a lot of studies have shown decreases in leptin production with sleep deprivation. Of course, we know that leptin is an important hormone affecting satiety levels in the brain. So that's going to affect feeding behaviors. It's going to increase appetite, and leptin also affects energy expenditure and glucose regulation. And many studies have also shown that sleep deprivation increases ghrelin, which is, of course, our primary hunger hormone. So again, that's going to stimulate appetite and eating behaviors. So, we know that sleep is important for so many reasons, and that hormones and these neurotransmitters play a really big role in eating behaviors and even activity levels and things like that. So, in conclusion, they state that, again, fragmented sleep is associated with obesity, and that the improvement of sleep fragmentation may contribute to decreasing the risk of obesity. So, again, just a couple of things. I think one thing that they didn't talk about a lot is the fact that we know that people with obesity have much higher risks of obstructive sleep apnea. And this could be one of the reasons why they had much higher levels of sleep fragmentation. So, just to give you a little bit of context here, we know that in men with a BMI over 30, greater than 50% of those men are going to have sleep apnea. And when we're talking about BMIs 40 or greater, we know that 94% of men and 74% of women with a BMI greater than 40 have sleep apnea. So this is something that the authors didn't really talk about, but I think it's just important to recognize. And it's really important that we're screening our patients for things like sleep apnea. So I recommend using the Stop Bang screening tool, which can be found at stopbang.ca, as a great screening tool for your patients to make sure that they don't need to be tested for sleep apnea. And if they do need to be tested, please test your patients for sleep apnea and make sure that they are able to get treatment for sleep apnea. It's going to play a huge role in managing their obesity. And in addition to that, we also need to be discussing good sleep hygiene with our patients and work together with them to try to prioritize sleep as much as possible. So more information about this, I write about this in my book, Developing an Obesity Management Program, The Healthcare Provider's Roadmap. And that is, of course, available at gaininghealth.com. So that's all we have this week for What's Up Wednesday. I hope you join me next week for another episode. So until then, take care and have a great Labor Day weekend. Bye.